Opening the mouth, where the movement takes place. Can you see? What is this joint called as? Name of this joint? This joint is called as temporomandibular joint. That is, this is temporal bone and this is mandible. So joint between these two bones is called as temporomandibular joint. So you can see opening of mouth, opening and closing of the mouth, temporomandibular joint. Then
the frontal
which? Yeah, this is in this. Okay. We have two joints for opening. Next, what is this? The name of this bone? Occipital bone. So joint between this occipital bone and the first cervical vertebra. This joint is called as atlanto-occipital joint because this first cervical vertebra name is called as atlas. Atlas. So we call it as atlanto-occipital joint. Joint between atlas and occipit. Okay, so atlanto-occipital joint. Same way, joint between first cervical vertebra and the second cervical vertebra. First cervical vertebra and second. So first cervical vertebra SM name is atlas. The second cervical vertebra name is axis. So this joint is called as atlanto-axial joint. Atlanto-axial joint. Joint between atlas and axis is called as atlanto-axial joint. Okay, so these are the three important joints here in this area. Movement for atlanto-axial joint. It is actually a what type of joint? I told you it is like a trochoid. So the movement is nodding of head like this. Rotation. Rotation of head is done by this atlanto-axial joint. Now coming to the shoulder. So first major joint, important joint is this glenohumeral joint. That is joint between glenoid cavity and the head of humerus. So glenohumeral joint. From here we go. This is clavicle. So clavicle and the joint between these two. This is called as acromioclavicular joint. Joint between acromion process and the clavicle. This joint is called as acromioclavicular joint. Through the clavicle, just go medially. Here we have a joint that is called as sternoclavicular joint. Very good. Sternoclavicular joint. Same way we have another joint behind, that is scapula attached to the thoracic cavity. So this is called as scapulothoracic joint. Very good. Now coming down to the elbow. Elbow joint has humeroradial joint and humero-ulnar joint. Humeroradial joint is the joint between head of the radius and capitulum. Ulnar here, this is a joint between the trochlea of the humerus and the coronoid process of ulnar. This two will form a joint. This is humero-ulnar joint. So this forms the elbow joint. Elbow. Next we have superior radio-ulnar joint. The superior radio-ulnar joint is the joint between head of the radius with the radial fossa of ulna. There is a fossa here. So this head of the radius articulates with radial fossa in the ulna. This is called as superior radio-ulnar joint. Superior because up. Because we have another radio-ulnar joint here, that is inferior radio-ulnar joint. In inferior radio-ulnar joint, the head of the ulna articulates with the ulnar fossa in radius. The head of the ulna articulates with ulnar fossa in the fossa of the radius. This is inferior radio-ulnar joint. Now, what is the movement of this joint? Because you know other movements. In glenohumeral, flexion, extension, abduction, adduction, circumduction. Elbow, you know, flexion, extension. What is the movement in radio-ulnar joint? Yeah, supination and pronation. Biomechanically, in which position you will get good supination and pronation? In which position of elbow? With elbow extended or with elbow flexed or with elbow initial. Which position you will get good supination and pronation? Which flexed 90 degrees. Last class we saw. If the elbow flexed 90 degrees.
The biceps.
Yeah, biceps will be in extended, the biceps will be stretched. So you can't do good supination and pronation. So if you flex the elbow, the biceps will be relaxed. So you will get good range of supination and pronation. It's an important biomechanical point. I told you in last class.
Yeah.
Okay. Now next joint is wrist joint, otherwise called as radiocarpal joint. Radiocarpal joint means joint between the radius and the proximal carpal row, that is scaphoid, lunate, triquetral and pisiform. This proximal carpal row, so the radiocarpal joint, wrist joint. Okay, this is wrist joint. Next we have midcarpal joint, that is joint between the proximal carpals and the distal carpal. Okay, so between these two lines there is a joint, that is midcarpal joint. After midcarpal joint, the carpal bones joins with metacarpal. So what is this joint?
Carpo-metacarpal joint.
Metacarpophalangeal joint. Carpo-metacarpal joint. I'm sorry. Carpo-metacarpal joint. Now same way, metacarpal to phalanges. So what is that? This joint is called as metacarpophalangeal joint. What about this? This is interphalangeal joints. So the first one is called as proximal interphalangeal joint, and the final this distal part. So this is called as distal interphalangeal joint. Clear? So this upper limb joints are clear. Yeah. Huh? Lumbricals is not a joint, it is a muscle. Lumbricals is a name of muscles which is situated in between this metacarpal, like this. It's a fibers. So these are the lumbricals muscles. So lumbrical muscles, what are the action of the lumbrical muscle is like this. Keep your hand like this. This is your action. That is flexion of metacarpophalangeal joint and extension of fingers. That is interphalangeal joint. Clear? Always, what is the action of lumbricals? Keep like this. Easy. There is flexion of metacarpophalangeal joint and extension of interphalangeal. This is very important. Why lumbricals is very important? Because it is called as intrinsic muscles of hand. That is small muscles of hand. This is very useful for picking up all the objects, what all the hand functions, grasp, for everything. It is very useful. Yeah, very useful muscle. Okay. Now coming to lower limb, we should see here, we have an important joint between the sacrum and the iliac bone. This joint is called as sacroiliac joint. Sacroiliac joint. So we have one right and left. The joint between the sacrum and the ilium, sacroiliac joint. This joint is of very importance for physical therapists because mostly we will get the patient with sacroiliac joint strain. If you can lift more weight, say some 50 kg, 60 kg, you will hurt your back, right? Some sprain. Where that sprain is happening mostly? In the sacroiliac joint, right and left sacroiliac. That's why always you should flex your knee, keep your back straight, then lift. Don't lift like this with flexed trunk. Then you will get a sprain in your back. So this is important. Sacroiliac joint. Next, same way, joint between sacrum and the fifth lumbar vertebra. This is called as L5 and the sacrum, last lumbar and the sacrum. This is called as lumbosacral junction. Lumbosacral junction. This is very important because again, back pain, here lumbosacral junction, spondylosis or disc problem is one important cause for the low back pain. Clear? Now coming to joints of lower limb. What joint is this? What is the name of this joint? This is hip joint. The head of the femur articulates with the acetabulum. See how stable is the joint. Inside, the head is going inside the acetabulum. Yeah, beautiful. So it has a very good stability. That's why it is in the position to bear the whole body weight. Whole body weight is in these two lower limbs. So this can bear the body weight. Assalamu alaikum. So this is femur and acetabulum articulating. Now coming down, we have a important joint. This is also very important for physical therapists. So this joint between femur and tibia, this joint is called as tibiofemoral joint, where we get flexion and extension movement. See the joint between the femur condyles and the tibial condyles. This is tibiofemoral joint. Then another joint here we have is joint between patella and the femur. So in this area, patella will get attached to this area. See like this. This joint is called as patellofemoral joint. Patellofemoral joint. Okay. So coming down, we have other joint, ankle joint, where we get dorsiflexion, plantar flexion, ankle joint, otherwise called as talocrural joint. But ankle joint is enough now. Clear? So in this, again, it's very important. You should know the bones of the tarsal. Okay, so what is the name of this bone directly attached to tibia? This is talus. Very good. The big bone, what is this bone? Calcaneus. Very good. Now, in the medial side with the great toe, if you come, you have a bone, and this bone is called as navicular. Navicular. Same way, this side, you have a bone that is cuboid. Okay, here you have cuboid, and this you have three cuneiform bones, medial, lateral and middle or intermediate, three cuneiform bones. So this is talus, under the talus is the big tarsal bone calcaneum, and then to the medial side is navicular, and here is the cuboid, and you have three cuneiform. These are the tarsal bones. Totally how many tarsal bones are there? We have 8 carpal bones in the hand, in the lower limb, in the foot. We have 7 tarsal bones. 7, see? Talus 1, 2, calcaneus 3, 4, 5, 6, 7. Totally 7 tarsal bones. Clear? Now, in between the tarsal bones, we have various joints. So, first important joint is, this is talus, and under the talus is calcaneum. So, joint between talus and calcaneum, this joint is called as subtalar joint. Sub means under. So under the talus, under the talus we have subtalar joint. This joint is subtalar joint. Yeah. What is the movement here? Inversion and eversion. So here what is this joint? Tarso-metatarsal joint. Between the tarsal and the metatarsal. Tarso-metatarsal joint. Between the metatarsal and phalanges, metatarsophalangeal joint. And metatarsophalangeal, this is proximal, this is distal. Clear? Okay. Yeah. End is, it's distal interphalangeal joint. Here this is metatarsophalangeal. For great toe it is like that. For here you have proximal interphalangeal joint and distal phalangeal joint. But for great toe we have only one interphalangeal joint. Okay. So this is for the lower limb joints. Clear? So these are the important joints which you should know. What are the joints? For all these joints you should know the movements also. I think you know the movements also for all the joints. Right? I'll tell that also for I will make it fast. So what is the movement with the sternoclavicular joint? Elevation, depression, protraction, retraction, and clavicular some rotation. This is the movement of sternoclavicular joint. Same way we have acromioclavicular joint. What are the movements? Acromioclavicular.
Depression.
Same we have elevation, depression of scapula. Same way for scapulothoracic joint. You have elevation of scapula, depression of scapula, abduction of scapula, abduction of scapula, and outward and inward rotation of scapula. If this goes like this, outward rotation. If it goes up like this, inward rotation. But these and all are, as I told you, this and all is passive. It's not a active movement. You can't do separately outward rotation of scapula. It is a combined movement when you do this. But active movements is more important. So that is inclinohumeral joint. What are the movements? We have flexion, extension, abduction, adduction, medial rotation, and lateral rotation. Okay. In elbow, flexion, extension. In superior radioulnar joint you have supination, pronation. In wrist joint you have flexion, extension, radial deviation, and ulnar deviation. In metacarpophalangeal joint, flexion, extension, abduction, adduction. Interphalangeal joint, flexion, extension. Clear? Same way hip joint. What are the movements you know? Flexion, extension, abduction. Same like shoulder. Same for tibiofemoral joint. Flexion and extension. Ankle joint.
And slight rotation.
Slight rotation, but you can't do actively. That is a assisted. Okay. Then what about ankle joint? Plantar flexion and dorsiflexion. Subtalar joint, inversion, eversion. Okay, and then metatarsophalangeal joint, flexion, extension. Simple. Okay. Yeah. Then trunk movements. You know what are the movements of the trunk? I've told you first.
Rotation.
For the trunk, first flexion, extension. Okay. Then
Yeah.
rotation. Then this is lateral, left lateral flexion, right lateral flexion. This is the movement of the trunk. Movement of the neck. What are the movements of the neck?
Flexion.
Flexion,
Extension.
extension.
Side
Then side flexion.
Rotation.
Rotation. Do it correctly. See, why I am teaching movement is because these movements only you are going to teach them as exercises.
Yeah.
Right? So you should do the movements clearly. Most of them they will do movements for the neck. You will get sprain. So you should do the correct anatomical movement so that they will not get any strain. They might feel relaxed if you give a very good exercises. If you do rhythmic way, so flexion, extension. Okay, this lateral flexion, right lateral flexion. Now, right rotation, left rotation. Kalas. Okay, so these are the movements of the neck. These all you have to. Now, for axis and planes, you know all the axis and planes.
Yes.
What are the axis and planes?
Front.
Frontal axis. That's all. For all the movements, I may ask you. For example, in the anatomical position, what is the axis for knee flexion and extension? Knee flexion, extension. What is the axis? Sagittal plane. Very good. Then axis.
Mediolateral.
See, when sagittal plane is there, sagittal plane means it is in anterior-posterior direction. Then how the same way axis will be? Axis will be opposite always. Remember like that. If plane is in one direction, in the same plane how there will be a axis. Okay. Next, subtalar joint. Inversion, eversion. So where? Inversion, eversion. It is in a transverse plane. Inversion, it's up, inversion, eversion. Axis, how it pass? Vertical axis. Okay. Same way, supination, pronation.
Transfers.
Transverse plane. Radial deviation, ulnar deviation. Radial deviation, ulnar deviation.
Sagittal.
Frontal plane. See this direction. This going anatomical position also. See
Like this.
this is like this.
No.
Yeah, frontal. Frontal and axis will be anteroposterior axis. Clear? So this is for revision for your exams, and then we will start with for today's class. Depression, which frontal, because this direction. See, very simple. Only rotation movements will be mostly in the transverse plane and vertical axis. All other movements mostly it will be in this either sagittal plane or the frontal plane. So if any movement in the front and back direction, sagittal plane. Any movement in the same direction, this is a frontal plane or horizontal.